So without question, the main teaching point or the main experience that we want both our interns and fellows to have is becoming competent within the primary care behavioral health model. And then acronym that we really like to infuse within or embed within our trainees is the GATHER acronym, which basically stands for being a true generalist, seeing all ages, seeing all conditions, being as accessible as needed. So if there's a handoff that comes through, that we want to be on demand for our primary care providers, for our MAs, for our nurses, and for our patients. Being team-oriented, so seeing patients in exam rooms, working together as a team, sitting in medical pods, completing co-visits. Being highly productive, so being, again, taking population-based health principles that we want to see as many people as we can, touch as many members of the community that we can, and provide as much intervention as we can. Being an educator, not only with patients, but then also with providers, our nursing staff, our MAs, our administration, really having everybody in community health in Central Washington be more behavioral savvy. And then lastly, being a routine part of care. We want behavioral health and the inclusion of a BHC to be the expectation, not the exception. And we want to move behavioral health from being a nicety to being a necessity. So we're really trying to imprint on our trainees this GATHER acronym. I would also say within the GATHER acronym, we also are really trying to train our fellows and our interns to understand what primary care is all about and the goals of primary care. So we use the GATHER acronym to achieve the goals of primary care, which can be summarized in the 4 C's of first contact, so seeing as many patients as you can and having the first contact with patients. Have a continuity along the lifespan with patients, providing comprehensive care for anything and anything that shows up or anything and everything that shows up. And then lastly, helping coordinate care when it's needed. And I think the coordination of care, it's not that if we have someone go see a specialist, regardless if that's a specialty mental health provider, regardless if that's a cardiologist, regardless if that's ortho, we never, as a primary care system, lose contact with that patient. While we might be helping them coordinate care, we still remain their primary care team. So in addition to the GATHER acronym, we very much try to inundate our fellows and our interns to understand primary care through the lens of the 4 C's.